this is going to be very action step oriented. Some of these things, like obviously you might already be doing, which is great, then don't worry about those ones. But I think my goal will be is everybody has probably 3 to 4, maybe 5, depending on the simplicity of it, of things that you focus on, and then figure out like where in your routine you can kind of add those things in. So I really believe that with kind of the amount of stuff that we know, about the lower back now, I mean, really, it's like, I think we've gotten to the point where, barring extreme circumstances, like there's really no excuse to like live with much of this going on, but it does require work. So I'm going to go through some basics, and also I'm going to go through some kind of like common conditions, because I think a lot of these terms get thrown out, and sometimes they get thrown at you as patients, and you're like, what does that even really mean? So I'm going to go over that really clearly. But in the lumbar spine, or AKA the lower back, you have 5 vertebrae, all right, or bones. And of course, with the lower back being at the very bottom, its primary function is stability, okay? Because think about it's holding basically like your whole upper half of your body concentrated in that spot right there. Of course, it's going to protect your spinal cord and then the nerves, and again, half your body weight is essentially gets concentrated on that lower back, which is why it can become a problem if it does lose its stability or its movement. So if you think about it, what it's built for is to do these 2 things. These are also where the key like lies on, or the keys lie in terms of making it better, is we need to improve its stability and improve its mobility or its movement, because those are the things that when they fail is when they start causing issues. So some other anatomy, the facet joints, okay? They are in your spine. Just looking at it from the side here, when you get adjusted and you hear like clicks and pops, right? Those sounds are actually coming from the facet joints. They're a very specific type of joints, but they really help, they guide our flexion. So a lot of times when, like it's hard, if you have bad facets, it really hurts on going into extension or leaning back, right? Because when you're going backwards, you're loading those parts of the joints right there. And so those are, one of the things that we adjust. But they also help guide the twisting motion as well, too. So they can also become arthritic. So they show you like little chart, like you can see like kind of a clean line joint there. And when they break down, they can literally get kind of crusty and crumbly a little bit there as well. With the disc, so, oops, a little cut off. But with the disc, on the left is a healthy one, and on the right is a sick one. And here's like the biggest takeaway with why I wanted to show this. There's very, 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 very little blood supply to your discs, okay? So you think about like your muscle, even your bones themselves have a lot of blood supply, but your discs have very, very, very little blood supply. So meaning that the way they get nutrients actually comes through motion. And so that's why we have people use the wobble cushions like before they get adjusted, and hopefully at home, which we'll talk about in a little bit, but is because that motion, that pumping motion, literally brings nutrients in, and it'll flush the waste out. So when the movement decreases, or if it gets really bad, the whole joint gets fixated, as that movement is not happening, then the discs do not get nutrition, and then therefore they begin to decay and erode. So I don't know. I mean, I guess I can assume why God designed our bodies that way. It's because he wanted us to move, right? Because like when we do move, then they get everything that they need. But that's why sitting is so bad for us. But even standing all day in the same place is bad for us too, because it's meant for being dynamic, right? So there are shock absorbers, right, in our spine. So that's why when they break down or decrease, right, they lose their hydration, they break down, right, then that's when we start feeling a lot more in our spine, or things feel like they catch a lot, or they kind of grab us from here. It's because that shock absorption is gone. Your body is going to feel more of the forces of life, right, because it doesn't have that shock absorber built in. Now, I always like to, when I'm working with a new patient and explaining like the anatomy of a disc, we always use like the analogy of like a jelly donut, right? Maybe heard that before. So it's like you got the squishy part in the middle. You got, I mean, not that it's tough, but it's like holding everything in place, right? But if you smash down hard enough on one side of a jelly donut, the jelly is going to squirt out, right? And that's really how bulging discs or herniated discs happen. is because these fibers right here that are tough in the body, they're very tough, called the annulus fibrosus, right? When that decay happens, then the structure weakens, and that's when that jelly can get pushed out through that. So when we're looking at the most common conditions of the lower back, I start with subluxation. So subluxation is the condition, if you will, that we work on as chiropractors, and I call it the primary one, because when a subluxation starts and then goes uncorrected, then these are the symptoms that come from it, okay? And so subluxation is misalignment, which leads to lack of proper motion, which causes nerve problems, right? And then ultimately, any combination of these things can happen as a result of that. Exactly, right? Yeah, well, so again, the bone misaligns, you get nerve compromise, right? The discs become fixated so they don't get that proper pumping motion in through there. You can get pain if it's hitting the nerve, or the joint begins to break down, right? Or it even can cause inflammation. So I always think about this through the primary, and that's why whatever lower back condition that, so anybody ever asks me, it's like, my friend has blank, and it's like, can you help with blank? I'm like, well, if they have subluxation, whatever the medical system has named it, if they have this going on, and I have a pathway to improve this, then the other things can get better, right? Maybe not go away, but they can definitely get better. So stenosis is a primary one that a lot of people get, especially as age goes on. And what that means is that this is like looking down the spine, kind of like a barrel of a gun, right? So this is where the spinal cord would be running through. And what happens is, due to inflammation and stress on the joints, you get abnormal bone growth, and the canal with which that spinal cord is running through begins to narrow. All right. Now, disc bulges can also contribute to that, but this is where we get a lot of like numbness for people, because what's happening is, like, usually nerve impingement causes more pain, and people, when they have stenosis, they get more numbness and weakness. So they can also have pain too, but it's more of a numbness and weakness type problem. But this, I will say, is the most difficult thing as a chiropractic, like for a chiropractic correction, if you will, to address, because at this point we're dealing with structural limitations. Now, if you think about like your bones stacked up on top of one another and they're all in a canal, right? Well, if I misalign one of those bones, that hole is going to already narrow further. So even if we're dealing with limitations, we're still trying to optimize alignment, because then we can still get the best flow possible through an already compromised area. So we can still help people with stenosis, but it is more limited by like structural damage. Well, stenosis can happen anywhere in the spine. Right. Yeah. But is that like a normal curve there? Not really. No. Yeah. You would get more of a flattening of the spine when you get stenosis too. So yeah, we'll go over that more in a second. No, it's a good question. Yeah. Obviously, everybody's heard of sciatica. I mean, everybody and their grandma's heard of sciatica. In fact, your grandma probably has sciatica or had sciatica at one point. But this is specifically compression of nerve roots coming out of 3 spots, or it could be a combination of 3 spots on the lower back, L3, L4, L5. Now, it can be one of those, it can be all of those, it can be 2 out of the 3, right? And those nerves have slightly different distributions, but they ultimately come together and form one nerve, and then it goes down. And that's, of course, the classic back of the leg, or slightly can be side of the leg there as well. Disc bulges or herniations can be a big cause of that, or just misalignments. But also, the sciatica can also come from a muscular problem too, called piriformis syndrome. So stretches are good for it. But yeah, I mean, sciatica is definitely, I would say, like the bread and butter of what like we can really help with. I mean, it's rarely that we can't fix or improve sciatica, with that. But that can be multifactorial as well. But classically, it's back of the leg and side leg. If it's more front, that technically wouldn't be sciatica. That would be a different type of nerve impingement, and it typically would look at higher up the spine. And so the cool thing is that the body is literally road mapped. Now, there's slight variations in all of us, but there's like kind of like some standards. And so that's why, if like you're ever like describing something, you know, and you're like, oh, it, you know, I'm just gonna use an example. Like it hurts like, you know, like right here. And it's like a lot of times like you guys as patients might feel like you need to tell like way more to the story. But it's like Dr. V and I, like based on anatomy, we already know where we're gonna be checking out. So it's not like if we're ever like, okay, go ahead, like, you know, it's like it's like we know what we need to do, you know, at that point. So because it's the body is road mapped like that, like for the most part. It's rare that there's like any curveballs in there, but they do happen. But it is rare. So all right, disc degeneration, degenerative disc disease, arthritis, right? Like this is a phased condition, if you will. So there's different levels to this. How I kind of think about this is that when we go from normal to phase one is simply just a loss of the disc height. So you don't have any type of like bone breakdown at that point. Disc one is kind of the bread and butter of phase one, excuse me, is the bread and butter of chiropractic, meaning like we can usually correct this 99.9% because like everything that needs to be there is still there. It's just kind of like squished a little bit, right? Now this is, you know, I would say is roughly like a 15-year process to go from here, meaning like you don't just overnight like wake up and all of a sudden like your discs have like lost disc height, right? It like usually takes 10 to 15 years for that. And it usually takes about 10 to 15 years to then move into phase from here. So like a total of 30, right, from the beginning, 20 to 30, where you start to see the bones begin a bone spur. Because now as the discs further lose height, then you get like a frictional process, right? And just like if you were to use your hands a lot and you would get a lot of friction, you get that thickening of the skin, right, calluses. You can essentially think of the bone spurs as like bone calluses, right? So as that friction is built up, the body will actually create extra bone for stability. It's almost like the body, which is smart, and it does what it can to stabilize us and protect us. It's almost like, okay, we're losing support here in the natural way, so I'm going to kind of make like my own sort of extra support measure, and it's, of course, it's not ideal, but it's like, it's almost like, well, if you ain't going to fix me, then I'm going to do the best that I can, you know, at that point. Phase two, I kind of always loosely say is like a 50 to 80% correction, meaning like unlikely to ever be like perfect at that point, but we can usually still like radically change that person's life. And then phase three, I mean, literally in 16 years of practice, 16 years last month, like, I mean, I've probably only seen a couple of dozen phase threes like in my entire career. Yeah. So, but well, here's the $1 million question, right? The $1 million question is, why do you think I have not seen many phase threes? Well, like I'm or like walking in as a new patient. Exactly. Like the point is, they're usually in the nursing home, or they're like their function is lost is so great that they're like, they're not coming in on their own power. They're not making their own decisions, right? Or they're dead, right? You know, so yeah, usually you would see, I mean, these type of people, I mean, even if they just have it on one part, their health is so bad in other ways. They're on, you know, multiple medications. Yeah.
I'm feeling better about that.
No, yeah, good. Well, then I'm glad you came already. You know what I mean? So, but here's the crazy part. It's like, you know, the body. Here's like kind of the point of this is that the body is actually, even though sometimes it can annoy us or frustrate us with how it responds to certain things, it will do its very best in every circumstance to protect us, to stabilize us, to do what it can to help us be around as long as possible. So that's why I'm saying, like, when we're talking like a 50-year process, you have to think about there's been 50 years worth of failure essentially, and lack of function and lack of proper motion for it to even get to that place in the first place. You know, now extreme trauma can speed this along, right, and really like trigger it. But interestingly, there was a study that came out when I was in chiropractic school. It's been verified a couple times here too, but there 20%, because it's rare that you would, you know, first of all, insurance would not approve like an MRI if there wasn't symptoms, right? Like you're gonna have to pay for that out of pocket. But there's been research studies done on like actually doing MRIs on healthy people that were like 0 to 10, 10 to age 10 to 20, 20 to 30, 40, 50, right? And they actually found that the average, or was like 18 to 25%. So almost a quarter, 20 to 25% of teenagers had one level or more of arthritis, like on MRI, like so like a phase 1-ish moving into phase 2. Or, not phase 2, because there won't be bone spurs, but already the loss of disc height in one or more areas of their spine by then. And it makes sense if you think about it, because it's like, you know, kids, especially nowadays, right? They're doing this like out of the womb, right? And then there's school, and so, um, yeah, for sure, right? And then, you know, most people also then are like not bringing their kids to a chiropractor unless they, you know differently, which a lot of our patients, you guys know, like until like there's a problem, and then by the time there's a problem, like we're already kind of in this section right here. So that was like a kind of a shocking revelation to like the orthopedic community and whatnot. But again, it's like in their world, there's nothing they can do if there's no symptom. You don't throw drugs at a problem like this if it's not causing pain, right? You're not going to do a surgery on that. So it's kind of just like interesting for us as chiropractors. It was like validation that we need to get our hands on people as young as we possibly can to try to, prevent a lot of this stuff. So, yeah, but you can really think about this here as just lack of proper motion. Remember, like I said, so it's like as this joint would get fixated, the disc water, which is mostly water, begins to dry out because it's not getting enough blood supply because it doesn't have a lot of blood supply, and then that motion's not pumping it. I like to use this also as like think of like a sponge, right? It's like, you squeeze out the dirty water, right? Then you suck up clean like water. It's that squeezing and pumping motion that's getting the nutrients in and the waste out. Okay, that process right there. It does, yeah. We're gonna talk about that. Yep. I'll give you a cool little tip on that. So I talked about this briefly. You can a little closer picture of the facet arthritis. Like I said, a lot of it, like when people are just standing for long periods and their back starts to ache, it's because those joints are loaded. So that's like a classic facet sign. Or the pain with twisting or pain with like arching, typically, because the way those joints are, when you arch, they load up, right? So they arch, they load up, and then so typically people with facet problems, they feel a lot better when they like lean forward and like stretch that way. Why? Because you're deloading or unloading those types of joints right there, which why this is also a very great stretch to do, which we'll talk more about solutions here in a sec. I'm just giving you some things. And I'll send this to you guys so you can kind of go through it a little bit more. Sorry, I don't know why my format is funky on the screen here, but so kind of in summary, discs require motion to stay healthy. So of course, sitting or immobility, because it's not just sitting. We say sitting is the new smoking, but really like standing in one place is not great either. It's like ideally, if you have a fixated job, you'd want to do a little bit of standing, a little bit of sitting, and kind of try to be dynamic with that as much as you can. You get what I like to call disc starvation, and then because there's little, it's slow healing, and so that's why regular adjustments are. Because guess what? We all are immobile more than we should be. So like the adjustments at least keep that mobility going, and then of course whatever you do on your own only helps and goes along with that. So long-term effects. So interestingly, like this also came out in chiropractic school. So this is like a big deal at the time, and it still is, of course. But they actually found that people that had chronic low back pain, their brains shrunk, which is obviously not good, right? Like if your brain is shrinking, like all of your cognitive function, everything is going to be controlled by your brain, right? So like essentially it's like having low back pain long enough, like it changes, like it like rewires who you are. And so we train on this probably once or twice a year, like, as an office, because a lot of times we have people come in that of course have had maybe low back pain for a really long time. And they might be kind of nasty, like, and it's not their personality, but their problem has rewired who they are. And then next thing you know, like they're a month or two into care and be like, is that the same person? And it's like, no, it's more like who they were before the pain started. Right. So, so it's a big deal. And that's why like low back pain is like really really the number one cause of disability, right. In America. And it goes beyond just like, oh, my back hurts. It's like it literally like can change who you are as a person. So, and also they found that it like, it shortens your lifespan too. So it's a big loss, function on that. And I think about the spine, like nursing home posture, right? I know you guys have probably heard me say that at least once a year, if not multiple times a year, for as long as you've been under care here. You have to, right? And so, I mean, one of the, blessings, or sometimes it feels like a curse of like, knowing what I know, like I'll be walking around and out in public and I'll see people, that are like this, or I'm like, oh my God. And I almost instinctively, like aggressively work on myself, and, there's nothing wrong with that for sure. It happens a lot. Yeah. All right. So we're going to go through solutions. Walking's super underrated. Of course, it's great for your health. I mean, I've never read a study ever that says walking makes you worse for anything, right? It literally helps everything. But I think it's a really sneaky, good way to help your lower back. And why? Because it's easy to do. I mean, it's a time commitment, but it's easy to do. I mean, even if you're limited in other ways, like you can do it. But it's that motion of walking, right? It really, like, it actually does create that pumping motion, while you're walking. So it's creating squish, 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 and like moving the good stuff in and getting the bad stuff out. So I really think it's like this and the wobble cushion, which I'll talk about next, is like the best two daily prevention tools that you could do, because you can do both of those things, even if it's 5 minutes. I mean, 5 minutes is better than nothing, but it's certainly 25 minutes. But it forces you to use your core and strengthen your glutes, all of which stabilize. Remember, stability and mobility. It stabilizes your lower back. The walking creates mobility. And then you add a weighted vest on. This is like a new thing that's kind of a rage right now, but it is good. And you wear that 5-10 pounds, like, on your chest there, and you load up a little bit more. It forces you to use your core just a little bit more, right? So you get that extra stability piece with that. So a lot of people have told me, because like in my weight loss program, this is kind of built into it, and they're like, oh, I wear it, but like it makes my lower back hurt, like after doing it. And I'm like, guess what that means? You're weak. No, it means it's weak. And so that extra 10-15 pounds on there, and you feel it down here, it's like it's loading those muscles, and that's how weak they are. And so like we're trying to strengthen that. So I tell them to push through it. So anyways, that's an extra bonus. And actually, just a little side note, you will burn 3 times the amount of calories by wearing a weighted vest. So it's like walking for 10 minutes. It's like essentially like walking for 30 if you're wearing a weighted vest. If you walk, for 20 minutes, it's like walking like 60, right? So you get way more bang for the buck with that. And, it'll be similar. Yeah. Yep.
And the weighted vest.
Mm-hmm. Yeah. Yep. Yeah. I'm just trying to think through that. I mean, you're getting more of an exaggerated motion, which is good for that. No, I know what you mean. Yeah. Absolutely. No, I mean, for sure. It's just, I'll say like the research on that, I don't know why it would be any different, but it's like whenever it's like, you don't see as much of the research on elliptical versus walking, right? But I can't see a reason why it would be any different. Yeah. I guess I would say the benefit I like about walking is you can also do it outside, which then you get that extra little fresh air and the sunshine, right? But yes, I know I'm with you. Biking would be similar too, right? I mean, you don't get as much with that. It's more hip down, but it would be good too. So wobble cushion, again, like super underrated. And it's like, sometimes I'm guilty of like, I know so much about health. It's like you sometimes like can overlook like the low hanging fruit, right? The simple things, right? And I think the wobble cushion, I mean, I really think this is like the spinal equivalent of like the brushing and flossing, of the spine. Meaning if you brush and floss regularly and you do a good job of that, you're unlikely to get major deterioration in your mouth, right? So there's a lot of science behind the wobble cushion. The term is called imbibition, and that's that sucking in of the nutrients and the pumping out of the waste. That's the technical term for that. But you also are strengthening, because like when you move this way, the muscles here have to react by contracting to stop you from falling over, right? But you're also stretching it, and then you go the other way, same thing. They will contract to stabilize you, so you get the little teeny tiny stabilizer of spinal muscles. They're called the interspinal muscles, because they're in between the bones. Actually, they get activated, that so they get stronger too. So it builds core along with building mobility at the same time. That's why I love it. And one of the things my mentor, who is really like my spinal correction mentor, said is that he would always recommend you do 1 rep per your age. No, like all the 3 directions. So that's why I put, if the person was 62 years old, they would do 62, 62, 62, right? And it was just, it's sort of a way, essentially meaning the older you are, the more you should do, okay, right? Or probably the more you need it. And this is just an easy way to just like have a set number sort of to focus on. Now, you may not always get the time to do that in here, but this would be kind of like a way you could do it at home. In fact, when people like go to his clinic, because he does like very like scoliosis and things like that, like very intense, he'll usually have, before he adjusts, just to give you like how like important this is for really like loosening the spine too. He'll have like, these are teenagers, he'll have them do like 200 reps before he even adjusts them. So like they're sweating before like they get adjusted, you know. In fact, he would say like, it'd be my preference that you're sweating from your wobble cushion before I even adjust you. You know, we don't go that hardcore in here. Maybe we should, but like you can think about this as like this. Can't tell you how many times people that have been stuck and stubborn, I'm like, do this, and like they'll come in like 2 weeks later, like, oh my god, it's like 20% better, you know. And like that's the only thing they do is adding that in. So again, it's simple, and a lot of times we can overlook that, but it really, really does move the needle. It's not just a fun thing we have you do is shake your butts in here, you know. Like there's really like a lot of thought behind it, you know. Okay, so nutrition for the spine. You know, simple kind of ear too, like here I would say, like I really think about like protein and collagen, right? Those are really like the primary building blocks for that. So it's no surprise to me when I see people that have bones that are breaking down and joints that are breaking down, they typically don't eat a whole lot of protein. It's like rarely do I have a woman come in, for example, that has like osteoporosis and they're eating like steak 3 to 5 times a week. It's like, they're like, oh, I eat meat once a month, you know? And it's like, well, if you're not putting the raw materials in for your body to take and then translate into tissue that's specialized for structure and function, it's like if you're not putting the building blocks in, you're not going to get a product out of that, right? So collagen is also specific, which is found in protein. That's like the tendinous kind of connective tissue. So, you know, this is where like the, you know, the like the what do you call it? Like the T-bones or like the strip steaks, literally, right, would even be kind of more beneficial than like the fillet because it's just muscle meat, right? So like the tendinous and like connective tissue that you can find, or why I think actually ground beef is excellent for consumption is because you're getting, I know it's kind of gross to think about, but you're getting all of that stuff mixed in. They just throw, you know, it's all in there, right? So I eat ground beef a lot, and it's of course a little bit cheaper too, which is nice. So you want to think about more protein to support better disc health. Magnesium is a huge one actually too for the discs, and that actually helps, you know, manage water content in the body as well. So that's why magnesium is kind of like a go-to. Everybody I think can benefit from taking at least a little bit every single day. And then for more, acute conditions, like if somebody's like really inflamed in their disc, the black seed oil and vitamin E are really good for the disc actually specifically. So
vitamin E oral or topical?
Yeah, oral. Yep.
Does it help if you topically put it on?
It probably wouldn't sink all the way in there. It would be, I don't think it would get that deep. So, I mean, again, it wouldn't hurt anything, but it might just be more helpful for the muscle on top of that. It's like you think about it. I mean, it's surprisingly like it's a lot deeper than you'd think down in there. Even though you can kind of feel parts of your bone, but you know, the tissue can be pretty thick in there. So hydration. So, you know, some of you might have seen me kind of riff on this on Facebook. I probably do it a couple times a year just because I always get reminded by somebody will say something. I'm like, hot, you know, like there's such a woven, like drink your body weight in ounces or whatever, and they're half your, and it's just like, no, that's just total made up, you know. You should drink when you're thirsty, or drink more if you urinate and you see some yellowish in there, right? Like you want to see clear urine and not feel thirsty. That's how you know if you're hydrated. That could vary on the day, right? Some days you might need a ton more. Some days you might not need as much there. But I think a lot of people can potentially overhydrate, and you actually can make your kidneys work extra hard, and your body will lose minerals the more you have to urinate, right? So you just have to be careful with that. So on that note, when you were asking about water, so yes, it does. But one of the things that we found is good is you actually, like, again, this would be easier to do at home. Like you chug some water and then you go do your wobble exercises, and you're actually, remember, you think about is bringing it in, like you'll actually bring the nutrition in. Or we'll have people, like, you can take collagen or do like the black seed oil and then you wobble, and it's like it helps facilitate bringing those nutrients in there. So a good little like routine, right, would be, and this could be like, I'm a little achy, long day at work or whatever. It's like you go home, you drink some water, do some collagen and whatever, right? Wait a few minutes and then start wobbling a little bit, and like you're literally going to be like helping your body usher those nutrients into where they need to go with that motion. Or of course a walk would do similar, right? But this would just be a kind of a concentrated way to do that. So it's a little kind of like, I put it as clinical pearl. It's like a way to, like, you're almost like, without injecting something in there, right, or whatever. It's like you're bringing it in by that motion through there. So yeah, they're mostly water though, and that's why dehydration can, we've all been there, right? We feel achy, we drink water, we feel better, right? So it's because those joints, it's called synovial fluid, and that's mostly made up of water. It's kind of like a jelly water, but it is water based. So another treatment, which, a little funny story, like, I don't know if it's funny, actually, it's actually a little disappointing in myself, is that I had this like stigma against decompression therapy for, I don't know, for a long time. I was like, it's not chiropractic. It's like, it's one of those things where maybe it's like, you don't want to admit that like a machine could be better at something, than you, right? And certain things, right? But then it's like you try something that you had a stigma in, and you're like, actually, that really helped, and I wish I was doing it. That's kind of how the spinal decompression thing went for me. I mean, we at my other office that I purchased over in Morrisville, they had that, and I was like, I'm gonna get rid of this thing, and then I was like, let me just try it. My back was like a little stiff that day. Let me just see what it feels like. And I got on and I got off, and I was like, hello. And I could like put my palms on the floor when I was done practically, and I was like, all right, we're gonna keep this thing. And then I got a used one to bring in here, for that, because they're super expensive. But this is the best way I have found to open up the disc spaces, right? Like V and I will kind of mimic it a little bit. Like we get on your leg, and I'm sure we've done it on all of you at one point, where we kind of like give it a little yank and a tug. But that's just like one little like kind of motion there. This is for some of you maybe have done it, but it's a sustained pull where it's really opening up. And what it actually, the big thing that it does, it's mechanical, but it's actually more even biochemical than mechanical. What I mean by that is when you open it up, right, it actually creates a negative pressure. And so it's going to suck in that water and those nutrients in there during that process. And then it releases and it kind of like pumps it out, right? So it almost like pumps you like an accordion this way, which is everything in the body is like designed to withstand gravity, right? So it has very little resistance against the opposite of that. And so that's why we can get a lot of, really even correction in there. But it's almost darn near a home run for especially the disc bulges and herniations. Like if people have like, they're like, I'm surgery. Like, I'm even treating a Canes guy right now, with this. And like to actually try to correct it, right? So it's great for that, but it's also good for what I like to call rusty joints. Rusty joints would be like the facet thing that I was talking about on the backside there. It just like creates that good motion. So it's a great like wellness, like monthly kind of thing to do. Like that's kind of how often I do it. And I just find like, even if I don't feel like I need it, I do it. And I can tell that it makes a difference in like just my mobility particular. But if we are dealing with like degeneration or, bulges or herniations, it can really, really, really move the needle. And so it may not cure things, but I find for people, if they're kind of in like a holding pattern, like they've started with us, whether it's 1 year, 1 month, or 10 years, right? Like they've got a lot of improvement, but they kind of get in this layer where it's like, it's better, but it's not amazing. I've been finding that adding this in tends to kind of like move us up a couple notches of like normalcy. So if you've never tried it, you just got to try it. You don't always necessarily feel like a magic bullet after the first one, or right away. Some people do, but like when we do the first one, honestly, the main thing we're looking for is it doesn't make you worse, right? And as long as it doesn't make you worse, then we know it will eventually make you better.
So does it change? I've done it twice.
Yep.
And for me, my lower back, the hardest thing is changing position. Like I can get into a certain position.
Yep.
Quickly, from one to another, down to up, things like that.
Yeah.
That hurt. Like I had a hard time getting off this table.
Yeah.
It felt great.
So the reason.
I couldn't move until the next, like an hour later, and then the next
Yep.
day I felt great.
Yep. So that's because I'm glad you said it. So because, like I said, your body has very little resistance to that motion. It's creating literally a force that it's like never felt before. It's like, think about it. Every single day you've been alive on planet Earth, gravity's been pulling you down, right? And so when you have a process that's doing the opposite of that, it's like a completely foreign concept to it. So that's why it can create a little bit of like a panic kind of feeling in your body, but also why it can change it a lot, because it's like there's no brakes essentially for it, right? That's why we can open you up a lot, with that. But because of that, sometimes it can irritate it. Now, usually it does it the first couple times, and then your body gets used to it, So, and might have pulled you a little bit too hard with that, and sometimes, but yeah. So, but yeah, and like some, it's like you get like that delayed response. So it's like as your body kind of settles down afterwards, like it sounds like it did for you. Then it's like now you're feeling the benefits, but it's that little bit of like kind of panic because it's like it does not compute. I don't know how else to describe it. Does that make sense though? Yeah. It's like it'd be like if they make those glasses, right, where it's like it can flip everything upside down, right? And, it's like you wear them and like your brain is like, what the heck? You like, it's like a party trick, right? But they've actually found, they've done this with astronauts. You wear them for 30 days, your brain will actually, when they take them off, and like it'll correct it. Like they actually start seeing upright from it. So the point is like your body adapts to it, but when it's been used to a certain way your entire life, and then you change it like literally in an instant, right? It can be a little bit of like, what's going on, right? So correct. Yeah. Yep. And usually, like kind of the more you need it, the more dramatic it might be. Like I have one lady right now that we do it, but unfortunately, it's like she's just so inflamed right now that whenever we do it, it makes her work. Like she literally, like we had to almost call 911. I thought we'd have to call 911 afterwards, and settle down, and she's okay, and she's fine. But like we're just looking for it to not do that, like where you like literally have to call 911 to get off the table. So I was like, oh my God, they're literally going to come in with a stretcher in here. I was like praying in the back. I'm like, get better, get better, get better, get better. And she's fine, but anyways, a little scary. Yeah, so a couple ways you can do. You can lay face down. We mostly do it laying face up just because the table we have, like the cutouts and all that, are more, built for that. But if we're trying to move the needle on like a condition, right? So like remember I said like monthly is like a great, I'm doing good. Like I'd love for my back just to feel like a little bit better. Just kind of being like a monthly regimen is good for that, like really good for that. If we're dealing with like a bulge or you're like, I have arthritis and I want to really take it to the next level, we'd want to do like a once to twice a week for like 12 visits or 24. It's like I just had a guy, he just got diagnosed with a herniation, in his spine right here. And I was like, okay, we're going to need to do 12 to 24. And I'm like, he's like, well, which one? I'm like, well, we're going to get to 12 and see where you're at. And if we need to do more. But this is where kind of the research has shown these are like kind of like 24 is essentially like if they're not that better after 24, it's unlikely to be a cause. But that's rare that a person wouldn't know that until they get to this point here. But usually what I'm trying to say is like we kind of get to maximum improvement at that number for like I said, for like a specific condition or like case that we're trying to move the needle on. We've had a lot of people cancel surgeries with, and this is one of those things where it's like I think about over the years all the people that I'm like, dang, if we would have done this, I would have had this, they would have gotten better, they never would have they never would have quit or whatever, right? Or they would have gotten better faster, with that. So it's I like to call it the quality of life. Literally it's going to stretch you into a better quality of life with that. So questions about any other questions? I'm glad you mentioned that because I didn't think about that. But are there any other questions about?
Ever since college tennis, I've
Yeah.
It hurts. So I sleep on my side or my back.
I have a
can't
slide
lay
on
my
sleep.
side. Will this like rigid
Well, this would be to work on a specific type of bulge in this picture, actually, because depending on the direction the bulge is going, that's how we lay the person.
like recreational, just sit on the carpet and watch a movie. Like I can do it.
Yeah.
It takes me forever.
Stability. Yeah, stability.
So like, will this help that?
Yeah. Yep.
Okay.
Yep. The other one is soft wave, which everybody here might have tried this or at least heard me talk about it before. But this is something I've added in recently where, like, again, these are like my tougher cases, like my Canes guy. It's like I'll have him do the decompression, opens up the space, and then I blast him with the sound waves right out of the soft wave right after that to try to get into there, de-inflame it, and actually try to heal the fibers that are busted in his case, or other people too. And so it's also great for like the SI joints, which are more like the butt, like right in through here. So that's more, they get really good in this, I think I did that on you the other day, right? And the SI joints flushes those out, which is kind of a different thing there. But this is something I found stacking really works well for kind of the more serious cases, the more like acute cases, for that. But in Europe, where this was invented, like they'll use this on all of their like spinal orthopedic cases, and they'll try to like use this before they even do cortisone shots and surgeries, right? As a more conservative approach, for that. So anyways, that's just I want to throw that in there because that's another thing that I've been kind of coupling and finding like can really, really be good, like as sort of like a sister kind of process. Well, like, or back to back, yeah.
Back to back, like same day?
Yeah, yep. I mean, again, that's one, like for the really, really inflamed people, that's how I'll do it on. And then I've experimented a couple times too with literally doing it while the people are on the table at the same time. Yeah, but in my mind, I'm like, that's a lot of like an ergonomic kind of hassle to do it, and so I just do it right after. So like a little, it's like I get them up and like we hustle them in there before like gravity kind of sinks in on them, and again, it's like just because we got to take advantage of as much of that space as possible, which is fun. All right, some other solutions. So remember we talked about core stability. So I'm not going to demonstrate these. This is the dead bug, which I actually think is like the best, right? The dead bug is probably the best exercise for core strengthening. So you literally lay like that, and then it's like opposite arm, opposite leg, overhead, right, as you're doing that, and you'll feel it. It's not like an ab, I mean, it is, but like it's more like deep in your core, you feel that. The bird dog is similar. That's where you're on, on your hands and knees, and you do it that way, right? Everybody knows what a plank is, right? A glute bridge is you can go, if you're not certain about these, you can just YouTube them real quick. That's where you lay on your back and you lift your pelvis up, right, and kind of squeeze your glutes with that. And then farmer's carries, that would be more like you're holding a weight, right, in your hands and you're walking because it forces you to use your core muscles. So, you're not, if you're holding a weight on, it's one side. So it's instead of walking like this, right, it forces your body to kind of hold it tight as you're walking. It's a big like. Nitiki, you've probably done a lot of farmers carries in that CrossFit, right? So, but you can just like take 20 pounds even, right? Or it's almost like you're just taking like a gallon of water, right? Or something like a jug of water. We've all done it, carrying a bag of groceries, right? Like that's essentially a farmer's carry. And so by not allowing your body to slump towards it and holding upright, that's working the side core muscles, right? Especially, and it's great for stabilizing that. So you can kind of think about that, those. But I love, the dead bug is number one, and it's just like it's easy, it's casual, right? And we'll talk about how to fit all this stuff in here in a second, because you're not going to fit all of it in, but we'll kind of talk about how to like work this into a realistic routine of doing that. But yeah. Okay. So posture ergonomics, I mean, I think that's kind of straightforward. I mean, I think we hammer you guys on that a lot, but I still want to mention it. It's like, the more you can be like this versus this, right, the better. Because there's really two patterns that people develop in their spine, and this the least common one is the hips tilt forward like this, and our bodies go like that over time. The most common one is we go this way, and then we go like that, right? So this is the nursing home posture, right? And so you've ever seen people like this, like, right? Because what the brain is always going to keep center of gravity as best as it possibly can, right? And so typically, because most of us sit, our hips rock backwards, right? Weak core is not holding us, right? And then we just gradually go like this, right? So, in fact, if I see people like this, and I'm way exaggerating, but you get I'm just showing you because you can see it, that I know that person's like really messed up because it's like that's an abnormal pattern, with that. So, we just want to think about, like a line through us and like you're drawing in, you're not like it's just drawing everything kind of in. Sleep positioning. I read a ridiculously compelling post on and kind of blog article, whatever you want to call it, on sleeping positioning that really is challenging me on how I think we should be sleeping. I was big on back sleeping, and I actually think side sleeping is the best way to do it now. Because what they were here's why. So what they were going off of is that's how like every other mammal naturally sleeps, right? I mean, you've never seen your dog laying on its back like this, right? Or I mean, they will do it a little bit, but how do they always sleep? On their side, right? And they tuck up, right? So it's the same. Or babies, right? They will naturally fetal position, right? And it was talking about our fascia and how it's most relaxed in that position, which is why babies will naturally do that. And so some for like the liver and the stomach, right? But here's the other thing is I actually think like within reason, your body will naturally go to whatever position is ideal for it. And so sometimes like I've always trained people like for like 15 years to fight it and like lay on your back on the rolls. And I'm not saying don't lay on the rolls, but I think trying to force yourself onto that is maybe not the best. And I'm still kind of working through it, but I'm just saying like, yeah. But also it's like I read this thing like the brain like drains its like kind of waste, if you will, better on the side too. So anyways, I'm like side sleeping pushing now. I just need to figure out how to like kind of work it into like this is like little preseason me kind of working through this, right? So but the point is I think your body's going to naturally go to its best position. So it's like don't fight it, I guess is what I'm trying to say too much, unless it's like really extreme and you're like, yeah, this is not good. Yeah, and you have to work around whatever limitations, right, are with that. But that's what I'm saying, like your body's going to kind of do what it needs to do best. I think that's the best to go with versus trying to force it to be a certain way is what I'm trying to say. And that means it's going to be different for everybody in this room, right?
I take my roll with me.
Yeah.
Actually, now my body, even when I'm asleep,
I do think like the pillow between the legs on the side is a great because it does help open up the pelvis and like kind of depressurize the lower back a little bit. So that's a little thing there.
get that on the side.
And a good mattress, right?
Cat could do that too.
What? Yeah. While I don't think a bad mattress really causes too many problems, I think a good mattress can help you. Meaning like people say, oh, my back is bad because I got a bad mattress. I'm like, well, I've had lots of patients over years, they change their mattress and nothing changes, right? But, if it's worn out, I mean, you got to think about that. Yeah, for sure. Yep. So micro breaks. And so this is like literally, I'm talking 15 seconds every 30 minutes to an hour can be insane, make a world of a difference. You guys have probably seen me do it, and I kind of almost do it subconsciously now, but like, my job, my shoulders have to roll inwards, right, to stabilize myself, hunched forward, bending down. I mean, yes, I use good posture here and all that, but I'm still hunching forward, right, more than I want to be. And if I'm really in the zone, I'm like feeling it as I'm doing it too. So you'll see me probably a lot of times, or as I'm waiting for somebody to come in, like I'm doing extension all the time because I'm always in flexion. I'm working on extension, and I'll just do a quick little like reset, right? Because I know it's like if my default has been like this, a quick little reset, I should probably get a little, at least retain a little bit of that extension. So because most of us are in flexion and like the death curl, right? Most of us need to do extension to work that out. So just think about like a little bit can go a long way with that, and like it adds up over the course of a day, a week, a month, right, in a year. If you do have to sit, right, it's like you get up, literally, it's like even just like a little bit of walking, a little bit of stretching, even if you're just doing that on the way to the bathroom, right, do your thing and then like come back, and it's like your body's going to be better off moving into that than, you know, getting up once for lunch and doing like a 20-minute, you know what I'm saying? So it's like a minute 10 times a day is better than 10 minutes once a day, I guess, is like the kind of the moral of the story of that. I know, yeah. And it's not just that even at work. I'm just saying like throughout the day, right? It's like if you're, anyways, I think I get the point. The point is like little slices is better than one chunk. That's like the moral of the story on that, okay? Of course, avoiding long periods of standing, but also avoiding long periods of standing. That's why it's like if you can be dynamic to some degree, that's better. And then I do like red light. I didn't have a whole slide devoted to that, but red light's good for the joints, the cartilage, the blood flow, and all that kind of stuff too. Theoretically, no. But we don't officially know, but like theoretically, no.
Red light with heat, does that matter, or red light on
Well, this would be like infrared, which, you know, yeah.
some of those.
Yeah, a little bit, yeah. But like near infrared or far infrared, they don't produce a ton of heat, like at least far away. So. Oh, I see what you're saying. It's different mechanisms. So, you know, heat can be relaxing for the muscle. This would be more to like really work on like cartilage and like joints. Yeah. Yep. No. Okay, so here's how I kind of think about this. What I like to do for these things, all the things that if I'm trying to incorporate something new, I find I have way better success if I stack it with something else I'm already doing, okay? So here's what I mean by that. I like to watch hockey. So I can either sit on my butt and watch hockey the whole time, or I can do some wobble cushions while I'm watching hockey, right? You know, or some bird dogs or some, you know, not that I'm saying I do it the whole game. I'm just saying like I will incorporate that. I can still watch the game while I'm laying on my back and my big freaking TV, right? You know, like there's enough to see that. I can do some wobbles, you know, well, you know, you guys get what I'm saying? So I stack it. Or like, you know, I'm already eating yogurt for breakfast, so I'll throw collagen, you know, in there, right? So I'm just giving you some ideas on that. Also, like if I'm, you know, if I'm going to go for a walk, you know, or a run or something too, that's a great time then to do some exaggerated extension stuff afterwards, right? Or some cobra stuff on the ground extension. Because I'm already loosened up, and it's like I'm already stretching a little bit of my legs and yada, yada, yada. So like I'll throw the other body parts in there too. So yeah, exactly. Yeah, you can stretch while you're walking, right? Or like I'm taking the dogs out to pee in the morning. They're doing their thing, right? Like I can do some stretching, you know, right? And some fascia work while I'm waiting for them to do their thing. You get, you know, versus like and I'm not saying I'm perfect, but it's like instead of sitting on my phone, what's the price of Bitcoin? What's in the stupid stuff in politics? You know what I'm saying? Like, that's one way to do it. Another way to do it is I could be working on my fascia and stretching and just getting limbered up and moving for the day, right? So just, I know it's super simple, but I find if like I have to add something in, my life is busy enough. It's like I don't have a whole lot of, I mean, I do have spare time, but it gets painfully difficult, right, to fit things in versus combining it with that. So yeah, exactly. Like you're already in there, right? You know what I mean? That's right. And listen, it adds up over 365 days a year, right? That's 7,000 squats or a year you wouldn't otherwise do, right? You know, so it's good. Okay, questions. So
I did have one more. I just asked the weighted vest.
Yep.
If you have, I've been afraid.
The best.
I feel my knee when I walk without it.
Yeah, the best way to strengthen it is to strengthen it. Yep. Yeah, the nice thing is they're actually pretty. You can buy them on Amazon. They're pretty cheap, and so you can kind of get like a variety of different weights. And like sometimes, like we'll just do a quick neighborhood one, and I'll put like my 35-pound on that. But there's no way I'm going three miles of my 35. Well, you could do it. I'm saying you could do it either way. Yeah. So if I'm going on like a long greenway walk, I'll wear like a light one because I don't want to like get tired and achy shoulders, you know, because it does kind of rag on them a little bit. But if I'm just doing like a quick like poo walk with the dogs, right? I'll put the heavy one on and it's like 5 minutes, right? So yeah. Yep. Yeah, but also overweight people don't move. Right? So I know you're thinking, but it's not right. So yes, add it in. Yeah. But yeah, it's a good question. So again, it's kind of in summary, think about stability, mobility. Think about the role, I guess, just kind of bring it all together, chiropractic and that the motion the benefit that creates, right? And like it's like low hanging fruit. And then we have more advanced things to bring in if like there's crisis or emergency or we're trying to level up a little bit. And then I think stacking is like the big key, like you're already drinking water, hopefully. So it's like if you're drinking water, well, maybe you could throw in a little bit of like stretching, like try to remember, like I'm gonna drink some water, so let me do some stretching right afterwards, because then I'm gonna like get more out of the water consumption, than I would otherwise, right? I mean, it does, but it's also like your body's gonna take that water elsewhere, but then you're drinking water and it's gonna replenish it. So I'm saying it's not like the one sip you did but it's like when your body has water coming in, right, it knows it can send it's called the interstitial fluid. It's directing it, right? It's all directed. So, yeah. But the nutrients, same thing. It's like it has anti-inflammatory properties floating around prostaglandin in its blood. But it's like when we pump it, like it's directed in there, and then your body replenishes it. So, yeah. Yeah, I mean, so theoretically, it would need to be like 5 maybe to 15 minutes of the actual collagen you're consuming to like get in there, right? But so you could wait. Oh, you mean the matrix one? Yeah. Yeah, I'm taking them all at the same time. It's just easier. Yeah. No. Yeah. Any other questions? So also, I'd say if you haven't tried the decompression, try it. I think everybody in this room might have tried at least once or not. Yeah, close. But yeah, I think that's a good thing to try, or maybe figure out a way what could be a good schedule for you to incorporate it more regularly. And obviously, I kind of tell you guys a lot of times, like I think you should do it, right? Like we've talked like the long road trip. Like I think you should schedule one when you get back, right? Yeah. So like I try to do my best too, but that's more. Admittedly, like I'm being a little bit more reactive in that moment, which is a better way to be reactive. But there's kind of would have to be more proactive on it in that sense too for that. So good. Okay. You were saying the stretching. Yes. Yeah, I mean, so that's for the hamstrings, because the hamstrings will pull on the butt, right? And remember that it'll create that, which is like the start of the breakdown in posture. So that's why I like this one, because it just helps lengthen that. And then but in general, we need to be more going just for generalized, because we all get so tight in the front. Everything gets so like that. So we're trying to open that up. It's both, and that's why again it's like on the wobble, it's like front and back, right side and side. Yep. So, yeah, and then to because I mentioned it, then just like thinking about the easy things, so like walking and like the 2 W's way, walking and wobbling, like those are like I think the lowest hanging fruit for like helping a healthier lower back. And water, I guess you could say walk and water. Make a little mnemonic out of that. Walk, water, wobble. Right? Boom, 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 boom. Yep. WWW. What would what would the wobble do or whatever? So yeah, good. Okay, good stuff, guys. Beautiful. Yeah, you're welcome. Yeah, exactly. Thank you much.